Today we're going to explore the 6 main types of assessment. Our lesson target for today is I can identify the type and purpose of each of the 6 main assessment types. The main types of assessments we're going to discuss today are a screener or screening process, diagnostic to include a pre-assessment, progress monitoring, formative and summative assessments. A screener is an assessment that's used to identify which students are and are not at risk. Screeners can help address both system level and student level questions. For example, for a system level question, a screener can answer the question to what percent of our 4th grade students are above the fall benchmark, as well as maybe whether or not we need a class-wide intervention. Are 60% of my students above benchmark? If so, then I know that I do not need to have a class-wide intervention. It can also address student level questions. Which students are not at benchmark? Or it can answer questions such as, did grade get any closer to the screening benchmark from the fall to the spring? Looking a little bit deeper, let's discuss the difference between the screening process and a screener. So a screener is an assessment that's used within a screening process. So the screening process itself can be a brief assessment, such as a screener, where all students are assessed in a grade or a school to determine which students are and are not at risk. Basically what happens here is a benchmark is set for a grade level and for a period of fall, winter, or spring, and then a student test score is compared to that benchmark. If the student score is above the benchmark score, they are considered a least amount of risk. If a student's score is below the benchmark, then they are considered a higher amount of risk. In an early warning system, some data sources that are used to determine the risk level of students are attendance, behaviors such as referrals as minor or major, as well as course grades. These are commonly referred to as the ABCs, and this is what helps determine if there's not a screener that's being used to determine the risk level of students. Then the screening process involves a sample of data, and so these are examples of 3 pieces of data that are commonly used. Characteristics of a screener: they're generally brief and easy to administer and score, predictive of later outcomes, which means that if a student scores below benchmark in the fall, we are concerned that student may score below proficiency on an Iowa State assessment or the ISASP. Generally, they're reliable, valid, capable of being administered to all students within the district, school, or grade, and you get immediate or near immediate access to results. A diagnostic assessment is used for students who have scored below benchmark on the screener or who, through the screening process, have been identified as at risk. So a diagnostic helps us to pinpoint weaknesses or identify strengths with specific students. An example of a diagnostic is a pre-assessment, and a pre-assessment is defined as any means used by teachers to gather information about students prior to instruction. So again, a pre-assessment is a subset of a diagnostic. I went into that before. So for a pre-assessment, again, this is a subset of diagnostic. It is not for a grade. It's also a type of formative assessment where you're looking to see where that student is in preparation for a lesson that you're going to teach. The purpose of a pre-assessment is to determine a student's readiness for the new content. This is going to be critical in the coming year. What we don't want to occur in the coming year is starting the year off with a big chunk of review. Research has shown that that is not effective and actually increases the gap from a student where they should be had there not been COVID and where they are because there was COVID. So we really want to look at each unit along the way, and possibly even at sometimes each lesson along the way. And thinking of like Unit 1, I want to give a pre-assessment around what skills might a student need as to be successful within Unit 1, especially if there's any skills that would have been taught in that fourth quarter in the prior year. And so when we give that pre-assessment, we use the data to determine if I need to have a short mini lesson to build that prior knowledge so that students can connect that prior knowledge to future learning that's going to occur within Unit 1. So progress monitoring is routine checks of learning growth that a student demonstrates. So progress monitoring is something we do along the way to determine if the intervention that we're using is effective, or perhaps the instructional strategy that we're using is effective. And so we're monitoring that literacy with Eli every week, and best practice with math at least once a month, perhaps every 2 weeks, to determine where a student is in terms of progressing towards that benchmark or that norm that we want them to attend to. Characteristics of a progress monitoring tool: again, brief, reliable, valid, repeatable, which means that there's a variety of forms. So the student's not taking the exact same test over and over. We want to make sure that there's a variety of different forms, yet they all have a similar level, which means that they're reliable and valid. And established benchmarks, expected rates of improvement available, and sensitive to improvement with detectable increments of growth. Formative assessments: these are things that we do on the fly in the classroom multiple times during a lesson. Its purpose is to plan for subsequent instruction. We need to know where a student is within their learning progression towards mastery of that goal. And Iowa talks about its assessment for learning. The benefits are it increases engagement in active learning, and it increases engagement in the classroom. It increases engagement if we have to teach virtually. It keeps students on task, it keeps them interested, and it focuses students and teachers on the learning target and where that progression is towards that learning target. Summative assessments are typically evaluative. These are usually for a grade, whereas formative assessments are never for a grade. So summative assessments provide evidence to the degree which a student has mastered the knowledge or understandings or the skill of a unit. They can also be projects or demonstrations or presentations. They don't have to be a paper pencil assessment. And so one of the things the DE does is that they have said that its summative assessment are assessments of learning. So formative is for learning, and a summative is an assessment of learning. So it's kind of a nice clarifier right there. So again, summatives are usually for a grade, whereas formative assessments are never for a grade. All right, here's a handy dandy little chart, and it talks about the difference between a formative and a summative assessment as well. And notice that formative pre-assessment is in that formative lane. Even though it's a diagnostic, it's still informing you about where that student is in their learning goal. And so we're finding out, what does that kid know? We're learning what's before the learning cycle occurs. It's diagnostic in nature, and again, it's never graded. Whereas a summative assessment is you're making sure that that student was able to make some of those connections, was able to carry that learning forward from the beginning of the lesson to the end of that unit, or the beginning of the unit to the end of that unit. Right? And it's almost always for a grade. And so those are the clarifiers between formative and summative. All right, that ends our overview of the 6 types of assessments. And thanks for watching.